Well, hello. Welcome to another show of Older But Wiser. Lorraine Callanan, how are you today?
Oh, I'm here.
We have a very, very prominent figure today. He's the senator of our area,
Yes.
Senator Galluccio. How
Thank
are
you.
you?
I'm
It's
great.
so nice
Thanks
to
for
have
having
you
me.
here.
Thank you very
Thank you
much.
for-
Yeah, and I understand we have a lot of different things that we can discuss today that are of great interest to our senior citizens. One of the things you mentioned previously to us before we got on the air is you have questions about the hospital in our city.
Yeah. Yeah, we'll talk maybe a little bit about the Cambridge Health Alliance and the healthcare system and healthcare reform. And I'm going to mention before we end some good things that are happening with retirement benefits for public employees. Everett has a lot of retired public employees that are waiting for some increases. So we'll talk about that too. But yeah,
Maybe we'll work
maybe are you? Are
Well,
you?
we're not
No.
employed, though.
Okay.
We're not employed. The
And you're not
salary we
retired
get-
either,
Well,
from what I can
the only
see.
retired I have is my car. I
Okay.
put 2 tires on it.
No, we you know, being my first budget as a senator, there were a lot of challenges that I had to confront on behalf of the Cambridge Health Alliance, and you know, Senate President Travellini had been a big advocate of the Cambridge Health Alliance, as he represented a piece of Cambridge and was really a guardian for the Health Alliance. He left the Senate, and obviously being Senate President, he was in a great position to advocate, and he left about a year ago. So this was the first budget where the Senate President wasn't around really to be there for the Health Alliance, and I took the lead on a lot of issues affecting the Cambridge Health Alliance. But we really have to be vigilant in looking out for the Alliance and the 3 hospitals that are represented, as well as the health clinics, because what's happened is while we as a state have worked to insure more people, to cover more people with insurance, with some form of insurance, the services that the Cambridge Health Alliance provides, the emergency services, the day-to-day inpatient mental health services, outpatient services, they don't do a lot of specialty surgeries, which is really where the money is.
Oh, I see.
What I've learned about the healthcare system is, you know, when you go in for your primary care visit, they're not making a lot of money on that. Or if you go in for an outpatient surgery or day surgery, they're not making a lot of money on that. Emergency services, mental health services, those types of things. Where the hospitals make their money is when my visit to my primary care turns into knee surgery or heart surgery. That's where the money is, and in most cases, folks go downtown, you know, to specialty hospitals for those services. So, but the type of day-to-day services that are so important to the preventive medicine that we care about are being provided there, but they don't get the reimbursement that is adequate to cover their cost.
Well, what about staying at the hospital? Not as many people staying in the hospital?
No, because again, a lot of the specialty surgeries, folks will go into Mass General or Brigham or Beth Israel. We do some, and we need, the Cambridge Health Alliance needs to become more competitive in those areas, because that's where the money is. But the Cambridge Health Alliance wasn't driven by money. It was always about community preventive medicine. So now they have to kind of change the way they do things to be more competitive because of the funding. But we as a state need to do a better job with those reimbursements for the types of services that they provide, because they're very important. But they were under a lot of pressure this year, and also a lot of folks who, despite the fact that we as a state have insured more people, there are still a significant number of people who don't have insurance who come under free care.
Yeah.
And those folks are still going to Cambridge and to Whidden and to Somerville.
Don't they get compensated by the state?
They do, but the reimbursement for free care is not adequate.
No, see, that's the trouble.
So we, it was just, I mentioned to you before we started because I hadn't realized, and what's happening now is the community hospitals are pitted against the city hospitals. If you're Winchester Hospital and you're not getting the money you think you deserve, you blame Cambridge, Cambridge, Whidden, and Somerville or Boston Medical. So I didn't realize how pitted against each other. So I need to really spend a lot of time looking for common battleground. We need to find allies in the suburban hospitals so that we're not pitted against each other, and we're advocating together for better reimbursement.
We got to keep them all in business, otherwise we'll be losing the emergency systems that are here for us.
Exactly.
Yeah.
I was shocked. I was really surprised how many different specialties they have up the Whidden. They have an oncologist.
Right.
They have the eye doctor, what do you call them? They have vascular man. They have a lot of things that you wouldn't think
that's
just a
always,
local hospital
that's
has.
right, and that's always been an issue because, growing up in Cambridge, you could either go to Mount Auburn or Cambridge.
Yeah.
And, Mount Auburn always had the better reputation. They need to do a better job. We need to do a better job of promoting. I went to Cambridge City the other day and had a great appointment with an orthopedic doctor. He was phenomenal. But, that's because I know. But we need to do a better job of promoting those services too.
Yes, yeah.
Because the more customers they get that are not free care, the better their revenue is. They need to get more covered, insured patients
People
to
that
go
are
there.
insured where the insurance company will pay the bill.
It's better.
So what are we going to be able to do for them to?
Well, I need to make more friends in the Senate so that when we talk, what I've learned in my short time up there is, Pete, you have to build respect with your colleagues because, when I stood up for Cambridge Health Alliance, if my colleagues don't respect me or they don't think that I do my homework, when I talk about something, or they don't believe if they didn't believe I was sincere, it would be very difficult. And I really worked hard in my first 9 months to gain their respect because it's those pivotal moments when millions of dollars are on the line, when I say, hey, you can't do this. We could lose a hospital here.
Yeah.
And if they don't, if at that point they don't respect you, people suffer. So I really work hard, and I don't mean it's not making great speeches. A lot of it's day to day, just building good relationships with the other senators.
You have to convince other senators that you're trying to help these hospitals is very
people
important.
Who need help, exactly.
And that.